disease and medication. Just the basic.
Mm.
For,
Okay.
just give us we have a bet, huh?
Are we
So
ready?
that our bet will learn also. Doc, liga dito. So start with the medication and disease.
Is he ready? Is it rolling? Action. Maiko, is it rolling?
Yeah.
Okay. So the question is disease and medication. My belief is to have the correct husbandry so you can eliminate as many diseases and problems that could come up. So I like to breed in suspended cages because I don't like bacterial contamination, I don't like fungal contamination, and I don't like parasites. Those are all big enemies of people raising birds. So if your husbandry is good to begin with, you're going to lessen the chance of getting all of those three problems. I always keep on hand Baytril as my general antibiotic that I use. Yeah, Baytril is a very good broad spectrum antibiotic. It's not the cure-all for everything, but if you're going to have one medication, I would recommend that one to have. Diflucan is used for fungal diseases, and the dosages, I don't have them offhand, but the veterinarian can give you an idea about that. And
what was the name of that for?
Diflucan. You know that, right?
Yes.
Yeah. It's typically a tablet. You crush it up and you mix it with some. Yeah. But those are things that every bird person that has an outdoor aviary or even an indoor aviary should have because they're common diseases. Bacterial, parasites are another thing. If you have a question about parasites, you should have a fresh fecal sample studied by the veterinarian. They can look for parasites in the feces. But there's all kinds of medications for roundworms, tapeworms, and things like that. Easy to take care of in the beginning, but they can be lethal and kill the birds if you don't take care of that problem. So, and birds are very good at hiding their illnesses.
How often do you deworm?
I typically don't deworm because when I have a bird in quarantine, or if it's a new bird from an outside source, the birds are quarantined. I sample the feces. I have the vet do it. And if I find anything wrong with the feces, of course, I'll treat it immediately before entering it into the aviary. All my aviaries are suspended. Once the birds are in there, there's very little chance of getting any kind of worms. So, but if you start off that way, then you have a much better result. You don't want to introduce it into your aviary without quarantining it and testing it. So,
Roger, you mentioned your cages are suspended. The flooring, do you recommend to have it cemented? Soil with grass or with sand?
yeah, that depends on your environment. Where I live, we have a very dry climate. It's not humid like the Philippines. So we have no problem with dirt or sand. Not with bacteria or fungus. Our problem is rodents or something like that. Because if you have suspended aviaries, you must make sure you skirt the bottom of the aviary so nothing can get under the aviary and like chew the legs of the birds or something like that. As far as parasites go, the roof is covered, because outside birds can defecate on top of your aviary. They can contaminate your water dish or your feeding dish if there's exposure. So start off with clean birds, and you're going to have a better chance of raising healthy birds. So, and that's why quarantining any birds that you get, very important. You can't see every disease, but you can try to do your best with the husbandry.
Do we need to do some medication before introducing a new bird? Like, the normal procedures of us Filipinos here is using general antibiotics before introducing something. I don't know how.
Yeah, I understand because look, it's expensive for a lot of people to take their birds for a workup with a veterinarian. And not all veterinarians in the Philippines and in other countries have the means to really identify the problems with the birds. But most vets should be able to do a fecal sample and look under the microscope if there's any worm eggs or something like that. But as far as a general antibiotic, you can do that. If you want to run a course of what your veterinarian recommends, you can do that. And there's certain antibiotics that work better than others for that. So again, I use Baytril as my broad spectrum antibiotic, but it's not the best for every situation. So, and I typically don't like to introduce medications if the birds don't need it. So that's why I will run cultures and sensitivities to see if the birds are carrying something. They might have a low level bacterial infection, And so, you know, but again, we have that resource in America.
Yeah.
Here it's not so easy. So probably it's not a bad idea to run them on a course of antibiotics initially. And and the veterinarian can guide you into which antibiotics are available and which he recommends. So,
What's your opinion on cuttlebone and grit?
okay. Yeah, grit's good. That's okay. Oyster shell is good. Cuttlebone, I've been feeding cuttlebone for 40 years. But then I realized I had it cultured one time, and there was so much bacteria on the cuttlebone. I said, hey, this is what the birds are eating, and it's full of bacteria. So now I don't use too much cuttlebone. I use more of a mineral block. It's made out of like a plaster of Paris, and that gives them a lot of calcium in that. And it's a lot cleaner than cuttlebone. But the birds love cuttlebone. I'm just saying, if you really want to be careful, culture it and see how it comes out. But the stuff I had is full of bacteria. But the birds definitely need a source, because most people here are feeding a seed diet. It's cheaper, I understand that. I'd recommend feeding a low-fat seed diet and augmenting it with fruits and vegetables, a lot of fruits and vegetables, and sprouted seed. If you guys can do it, it's more work, but sprouted seed is live food. It has a lot of enzymes, lessens the fat. The birds love it. You can chop up fruits and vegetables very finely. I feed a salad with the sprouted seed and whatever fruit I get from the produce store. And so they get that, and then they get some pellets and some seed. And I try to keep it low fat. In the breeding time, I increase the fat levels by adding more sunflower and safflower in the sprout mix and in the dry seed mix, because I believe that encourages the birds to breed more. Yeah, they know they're getting, the breeding time is here, they're getting excited to breed. When you give them that higher fat, it also, I think, it elicits more of a breeding behavior, because they know there's plenty of food to feed the babies.
When do you start the change in diet?
About a month before breeding season. So your breeding season, say, is, let's just make up a date. Say it's January for the Asiatic parakeets. So in the 1st of December, I would change the diet over. About a month before.
Any comment about feeding pellets?
Yeah, I have switched back and forth from pellet to seed. So now what I do, because I can't do all the work as I did before. I'm getting older and I'm a one-man show. So I feed, I used to feed exclusively pellets with fruits and vegetables. I've changed that now. So now I'm feeding, because the price of pellets has gone sky high in America. So now I'm feeding 75% low-fat seed. When I say low-fat, it's a cockatiel mixture, which I have hemp added to that. It has a small amount of safflower and sunflower, mostly millet and canary seed. And then I give 25% pellets, and they're free to eat whatever they want to eat. And then they get their fruit or vegetable also every day.
Do you mix it with the seeds, or is it separate dish?
I've done both. I've done both. But if you leave it separate, they'll eat all the seed, and they'll kind of look at the pellet and only eat it occasionally. But if you mix it with the seed, I think it stimulates them to eat a little bit more of the pellet. But they'll always leave some, because I feed every day. And the reason I feed every day, it's a lot more work for me, but I can monitor what the birds are eating. And I want them to eat all of the mixture. So my ideal way to see the feeding dishes in the morning is with just a few pellets left and a few seeds. Then I know they've eaten almost everything I've given them. So, next question.
Next, we're done with the medication.
So we went from 5% commission, now 10% commission. Next question, 15% commission.
Hard charges.
Okay, genetic